Hello, welcome back once again. Welcome back to this specific channel. Today we want to look at something new, and that is what we call the anatomy of the clavicle. We want to know what are the types, objectives of this specific lecture. We need to know the types of what are the parts of a clavicle that we need to know, and then what is a clavicle bone. So you find that a clavicle bone is a long bone, and it is called, we have different types of bones. You find in introduction to skeletal system, you find that you are taken through that. So look out for other types of bones, okay? So however, our clavicle bone is a connective tissue that is we talked to in the last slides or in the last lecture, that we have different tissues coming up to form different cells coming up to form tissues, and then different tissues coming up to give us organs, and then different organs giving us organ system. So a clavicle is one of the bones that form what we call the shoulder joint, and most of us know where our shoulder is. Another name that we can give to a clavicle bone, we can call it a collarbone. So most of us know and we can locate where our clavicle bone is, and then we see that it is a foundation of the shoulder joint. Okay, so it participates in a foundation of what we call a shoulder joint, because you find that it may have its articulating surfaces with any other bone that we can find at the shoulder joint, and we are going to see them in the next lectures or in the coming lectures that we are going to look at. So don't miss out. Keep tuned to Grapham Academy so that you don't miss basics, and then you don't miss concepts that you need in day-to-day practice in your field to become a better medical practitioner, to become a better practitioner who knows what they are doing and what they do. Okay, so you find that this bone as well, it keeps the arm away from the trunk. We should be knowing these parts of the system now, what a trunk is, what an arm is. So if you don't know them, kindly try to look out for them in textbooks and discuss with your friends and the rest. And then we see that this specific bone is the only bone that does not form what we call a medullary cavity. Okay, it does not form a medullary cavity, and then we find that it is stationed, or it lies along horizontally in the body. Is the only long bone that lies horizontally in the body. Okay, so after knowing or having a clear picture of what a clavicle bone is, we want to look at the types that you may need to have of interest, the different parts. So this specific part in your system or in the bond. Okay, I don't know, we can see the part properly. I don't know whether this is better. Let's see the part. So this is your part. We call it a conoid tubercle. Okay, so that is what we call a conoid tubercle, and that is how it looks like. Okay, so apart from that, we have this specific spaces here. So this is a line, we call it the trapezoid line. So when we zoom it, we can see or appreciate it is a clear line, or we can be seeing a line here. Members, I hope you can see something. I'm trying to show clearly this line. So we call it a trapezoid line. And then here we have the acromial facet, and then we have the subclavian groove. Okay, groove like a cave, us who have grown long time. Okay, and then we have what we call the costa tuberosity, and then we have the sternal facet, then we have the sternal end. Okay, sternal facet, sternal end. I hope you can remember some of the parts. Actually, write for me some of the parts in the comment section to see whether we have been moving together. And then we have acromial end. Okay, We have acromial end, we have the sternofacet, we have the sternohead, and then acromial what? Coronoid tubercle, and we have our groove here. I hope somebody remembers the name of the groove. Okay, we have our groove here, subclavian groove, and then this region, trapezoid line. Some people had even forgotten it, isn't it? Some people had what? Had forgotten it. So I was trying to zoom the line, if we can see this line. Okay, there are lines. So just look at the line, because it is forming something like a trapezium. These two lines, if you remember your trapezium of